Hey, I want to do another video and I'm going to talk about the cost that goes into onboarding, or should I say turnover. All right, so in the other video, I talked about really taking advantage of the onboarding process, and I really think as leaders in these facilities, we can do a better job doing that. So a couple things I want you to consider, when you're doing your when you have to think about the turnover rate and the onboarding process. Okay, there's a lot that goes into it. Okay, for one, let's talk about advertising. Advertising is expensive, all right, and I know, just speaking for myself now as a agency owner, when you have to put ads out on different platforms in order to try to get employees, candidates, that's a cost. Okay, so none of that is free when your facility has to do that. The other thing, it might be something small, but the interview process, when you're doing things such as like your screenings and background checks, again, another fee. And I know, again, speaking as an agency owner, I spend a lot of money on that, and it's a process that we can't skip. Okay. Another one is your orientation and trainings. All right, and I'm going to take it back again to the previous video when I speak about that 30-day, that 60-day, that 90-day of just tapping in with that new employee to really see how things are going for them. See if this is a place that they see that themselves can be working at, as well as them meeting the facility needs that you have put in place for them. Okay, credentialing, licensing, another fee. Okay, another fee. All right, in order to do credentialing and licensing, that goes in, that's another fee that's topped in on top of that. Your drug screening. And I will say this, I worked at one facility and they had their medical director do the new hire physicals that came there. Okay, if you have a clear license for your facility, then you know that you can do the drug test in-house. Okay, you might have the drug test kit that you or your staff who are trained can actually do that process, as well as the TB. Okay, so when it comes to, the drug screening and health physical, you have the ability to save a little bit of cost there. If your administrator is okay, your medical director is okay with, coming in on a day and perhaps doing some physicals. Okay, so that was one of the things that the facility had did where I worked at. If they were in any type of uniforms, okay, suppose you have branding for like nurses or CNAs, dietary, they might have a certain color uniform. All right, and typically what we do is we provide them with at least two, and then they might have to get their own thereafter. So, that's another fee. Okay, and then when you start getting into like the employee benefit package, again, another fee. All right, depending on what positions they're taking on, and if they have benefits that go along with that. Your sick time, your vacation time, your health, dental, vision. Okay, again, that's another fee. And then if you think about the onboarding process, that orientation process where they're actually then with that staff member, they're on the floor, but they aren't reaching their fullest potential yet. And it's simply because, they are new and they need to be oriented on all the processes that we expect them to do as the nurse leader of the facility. Okay, so then again, that's another cost because they are with someone. Okay, so you're paying that employee that already works there, that has been working there, to then train them. Okay, so now you're paying for two people at that time to provide care to one resident. Okay, again, another fee. And that's a fee that, unfortunately you have to think about when we're doing the onboarding process. But I wanted you to, just take a deeper dive into the cost of how much it is each time you hire somebody, each time we don't do a good job in really having an onboard process in place, and then what we can do to improve that process so that they can stay there. Because I was reading a article and it was saying like it's about $400, just in the paperwork side for each person that comes onto your facility. And if you are a person that hires, but then we don't hold on to them, those costs can go up astronomically. And, then when you start tapping in all the other areas that I spoke about, that's a pretty hefty bill, especially when it comes to the advertising side. Like I said, we don't see it, so you don't think about it, but it's a cost, okay? And as the DON, you are responsible for a budget in your facility, and that should be included in your operating agreement. It should be in there. Just get an idea, because you have things that you will be wanting in place in general for a facility. So getting that idea of what that costs. So start paying attention to these when you have your meetings. The reason why I wanted to bring this up is because one of the major challenges that we face in long-term care in these nursing homes are staffing. All right, so we need to do whatever we can do to keep the cost down. And how we do that is by hiring, doing an amazing job at onboarding, and doing whatever we can do to retain the staff that we do have. And then anybody coming on, remember, they serve as another reference for you, okay? So if they like it there, they've been treated well, then that's another reference of like a word of mouth to say, hey, I love it here, or I love coming to work here. They did this, they did that. I know the DON, the staff are really nice, or it might not be. It could be something, something totally different. So if you're having staff challenges, be the change that you want to see in your facilities, and develop an amazing onboarding process. Okay, once you find out that who you're hiring, and know a little bit about them, find out what their favorite drink is, find out what their favorite snack is, things that they like to do, and have them like little gift bags for when they get hired and come onto your facility. And it's just a nice gesture. It's a welcoming gesture, that will set the tone in the right direction for them now coming to be an employee at your facility. All right, so I wanted to just do a piggyback off of that, because onboarding, if you want to get your staffing under control, if you want to be able to employ qualified candidates, I highly encourage you to take a deeper dive into your onboarding process and see if it is meeting your expectations, and if not, what can you do as the nurse leader to then get it to that level. All right, so I hope this video helps, and have an amazing day. If you want me to talk about any type of discussions, let me know. All right, let me know, and I will be more than happy to do so. All right, follow for more tips.